Well, it's comforting for sure, especially in a group like this that, for the most part, they're very open and transparent, and all seem very willing to help. Um, it's just a feeling of support, and not afraid to ask questions and approach people. For me, well, actually, honestly, it was Nick because he just had a baby girl, and so I don't think I even told him congratulations. And but I love talking to Nick. Such great insight with what he does and his team. Motivation. You go through the year, and especially at home and with the family and the practice, and you get if there's just an isolation feeling, then you come to the summit and you get kind of re-energized, learning new ideas and best practices. It was seeing the numbers, the growth that we work on, every month, and are tracking that at all times, and then seeing that come to fruition in a tangible effect. A few best practices. I mean, number one is the same day surgery template in that model and how to run that efficiently, and then seeing that take effect in the practice, increasing growth, increasing efficiency with the patients and our schedule. Delegation, not letting go of delegation, but letting go of the need to micromanage, to have your hands on every single part of the practice, trust, learning trust, and letting go of that feeling that if I don't do it, it's not done right. I have the feeling now that I can walk out the door and things are taken care of. The office is being taken care of by the manager and our staff, and it's just a feeling of trust. Patient outcomes, I think it's multiple. It really, I mean, seeing the Google reviews, number one, and seeing that come into effect has been a huge change in our practice. This is a testament to our culture and staff and the systems we have in place. Feel more freedom. One, freedom at home. As a surgeon, you do bring that home at times, but now there's a feeling of that things are in control. Freedom of expanding the clinical practice, new techniques, broadening the scope, knowing that I have time to go to CEs, and I have more time to learn and more time to research. Time now with 3 kids, it's the kid stuff. It's leaving the office and going to practice. It's leaving the office and going coaching practice and the pickups and drop-offs. I have a feeling of trust where I know I can walk out the door and things are taken care of, and then be ready to go again the next day. It always be doctor-led. You have to lead your team at all times, no matter the systems in place and the help in place from Elvis 360. More energetic, knowing that what we're doing is providing a positive outcome for the staff, for patients, and then the overall production of the practice. Not surprising for others, but Barake, just the details of how you can break down a practice, which any private practice should know how to do that. But just seeing his passion for the way things operate and things you would never think of is, to me, he surprises me at all times. The emphasis on HR, specifically the installation of a true manager in place, and the support from the central team into making sure that manager is competent, adequate, and that makes a world of difference in how quickly that was put in place, and if a change is needed, how quickly that change was completed, and moving on to just the manager role. More engaging. They're ready to lend a hand, texting, calling, etc. Early on, of course, Dr. Everett's calling every couple of weeks, just checking in, was a huge part of the integration process for me. And then, even the once a year meetings, you may not see them for a year, but you walk in and you feel like you're good friends for a long time. I'd say it's worth it. I'd say it's definitely worth it. And if I could have done it again, I would have done it, 5 years ago versus 2 years ago. The feeling of they'll take over and tell you what to do, tell you what to use, tell you what implants to use, tell you how to treat patients. The office manager is running your schedule. They're running the clinic. It's not true at all. Full autonomy here, and that one part has never changed. Recent challenge was a change in the office manager, and the hiring of a new office manager that had great background with RCM within oral surgery. But we found out pretty quickly that she just wasn't a good manager of people. It's challenging for a few weeks, and I was kind of the therapist for my staff during that time, taking phone calls and reassuring. And then with the help of course, Amanda in the HR department, we made that change for the good, and then quickly brought on a new manager to lead our team. That is easier than I thought. Once we were integrated and off the ground and moving, it provided for me relief that I was very apprehensive about. Well, with the recent growth of my office and the growth of other offices, in a similar way, feeling very good about it. And I feel like if they can grow my practice in a competitive market in Dallas, then it can happen anywhere. Before I was overwhelmed, now feel more at peace and more trust and less overwhelming. It's continuing to improve, whether it's with staff relationships, whether it's clinically, whether it's treating patients, referral relationships, just improve. And if that leads to more growth, then that's great. And then on top of that, improve at home too, as a dad and a husband.